I want to thank all of our witnesses today for your service and your hard work. I'd like to address natural disasters and the pandemic because in Nevada, we are about to enter wildfire season. In the past month, we've unfortunately experienced multiple earthquakes, including a 6.5 magnitude event that shook our entire state. Flooding and other disasters also possible throughout the year. So I'd like to hear more about what FEMA and HHS are doing to prepare for responding to the COVID-19 pandemic while we are also responding to dynamically to these natural disasters. It's absolutely critical that we have a detailed concurrent plan or planning going on right now as we see the pandemic hitting, of course, across the country. We have to be nimble in order to respond, and FEMA, for you to address multiple disasters situation simultaneously. So for Administrator Gaynor and Admiral Jawad, how are FEMA and HHS preparing for testing for COVID, treatment for COVID, and vaccine delivery if power is impacted by a natural disaster? Are there additional mobile generators for refrigeration systems? Are these being acquired? What type of equipment might you need in a remote scenario? We have very rural, remote areas that get the wildfires, have the earthquakes. What supply chains could be disrupted? What do you need from Congress to start doing this, or have you started doing it? We'll start with Administrator Gaynor, please.
Yes, ma'am. Thank you for the question. And so if I can just zoom out a little bit and focus on some of the wider efforts that we've done at FEMA and across the country. And again, with my many partners here, Admiral Jawad, DOD, and many others that are not here, early on, probably before the president declared a nationwide emergency in March, we knew that hurricane season was coming, and we wanted to make sure that we were prepared for hurricane season with the overlay of responding to COVID-19. And so along that way, my team and my partners collected best practices, lessons learned, the best resources for COVID-19, and we built in 27 days, and I'm not sure if you can see it, but I brought a prop with me here, the COVID-19 pandemic operational guidance for the 2020 hurricane season. And although it says hurricane season, you could scratch that out and put in wildfire, or earthquake or flooding, because all the lessons learned in here apply to all hazards.
Let me ask you this question. I'm going to take a look at that after this, but is there strong support in there for our state and local agencies, our first responders? Is that in your document as well?
Yes, ma'am. Yes, ma'am. Back to my a line of my opening statement, locally executed, state managed, and fairly supported. In it, and I'll just give you an example about some of the challenges that we'll face this year. And it doesn't matter if it's a hurricane or a wildfire or an earthquake, is about sheltering. In it, we want to make sure that we stimulate conversation at the local, state, tribal, territorial level, emergency managers, state health officials, to ask those questions. What does evacuation look like in your community under COVID-19? Do you have enough space? Do you have enough hygiene equipment? Can you screen people? If you have somebody that's positive, what do you do with that? Are you going to do testing? So lots of prompting questions to have every emergency manager in the nation go look at their plans and make sure that they're up to date for whatever hazard they may face and COVID-19. I have held conversations with every state emergency manager in the country on this. We have an exercise kit that we encourage all levels of government to use to exercise those plans with COVID-19. So pretty comprehensive. I'll make sure that you and your staff have a copy, and I'd be happy to answer any questions after that. And if when it comes to testing, I'll turn over to Admiral Jawad about what testing may look like in the future.
Yeah, thank you, Senator, and thank you, Administrator. On the testing side, and I'm so appreciative you brought this out, it's the reason why we are working directly with each state individually to make custom evidence-based plans for those states. My multidisciplinary team has met with the multidisciplinary teams from every state now 3 times to establish the initial state goals, and we did this in late April. So for Nevada, your team's goal was 120,000 tests. We concurred. 120,000 tests were very good for your state. We provided all the supplies that are needed to do those 120,000 tests. Not only was it numerical, but there are specific issues, like your state is number 8 in relying on the public health laboratory. So you're very highly reliant on public health laboratory. And being the case, we supply more supplies to your public health laboratory than other states that are not so reliant on it. We also focus on any indigenous populations through the Indian Health Service. So it really is a custom plan for your state. And by the way, in May, your state did really good, just about met your state goals, certainly within a stone's throw of it. So we look forward to that. And now we are reviewing every single state plan as required by the PPP legislation, along with the $10.25 billion. We have a specific state plan that we're reviewing now for May and June, and then on June 15th, it will be the plan for the rest of the year. And again, this is a cooperative agreement between the CDC and the states, meaning we're working together. It's not the state's responsibility, it's not the federal responsibility, it's us to work together to make sure that that state plan is appropriate and can be executed.
And Admiral, I want to just follow up on something Senator Langford asked about syringes and things that we're preparing for a vaccine. And so what about our vaccine vial supplies? Do we have enough borosilicate, excuse me, that's the special glass that we need for those vials to contain the vaccine? If we don't have enough, are there alternative materials that we can consider using as we ramp up not just syringes, but the vials that are needed as well?
Ma'am, great question. So there is a little bit of a dividing line between my efforts and then Operation Warp Speed. I'm working closely with them, but they have a plan for vials and syringes. There's also a secondary plan of a new technology to a blister pack blown product where it'll be pre-filled, and that will be, you'll get the dosage in a blister pack and be able to open it and inject it and squeeze it so it's in one. We're actually using some investment money, the Defense Production Act, on that item. But Operation Warp Speed has all the details there, but because it has something to do with the supply chain, prior to the stand-up of Operation Warp Speed, I dived into needles and syringes, just because I thought that was, what's next. But I have to work with Operation Warp Speed to get you a specific answer on the vials, ma'am.
Thank you. I appreciate it.